clinical pathologic features from a case series with emphasis on differential diagnosis of chronic apical periodontitis, done by Luisa and Juliana from University of Rio de Janeiro in Brazil in 2021. Idiopathic bone cavity is an uncommon bone lesion that can affect craniofacial bones. This condition produces a radiolucent image in close proximity with teeth apices in most cases. The differential diagnosis usually includes chronic apical periodontitis. As endodontist may be the first dental specialty to be consulted in such cases, it's important to have adequate knowledge about this condition. The aim of this study was to report 30 additional cases of idiopathic bone cavity diagnosed in a single oral pathology surface showing the clinical and radiographic feature of this entity and calling the attention to the importance of this information to endodontists. All 30 cases was diagnosed in oral pathology lab in the university. Information about the pulp vitality and panoramic radiographs were available for all cases. All images were accidentally discovered in panoramic radiographs. Patient did not have any signs and symptoms. All cases were submitted to surgical exploration performed by oral and maxillofacial surgeons for diagnosis. Histological features showed loose connective tissue associated with small bone fragments and hemorrhage. Diagnosis was based on clinical radiographic and histological features. And Table 1 summarized the clinical and radiographic features of the 30 idiopathic bone cavities that was included in the study. As for the result, the posterior mandible was the most common affected site by 47%, followed by the anterior mandible by 43%, and 10% of the cases represent a large lesion that affects both anterior and posterior region of the mandible. And there was no bilateral maxillary or condylar lesion. All lesions were characterized by radiolucent image being unilocular in 87% of the cases and well defined in 80% of the cases. The mean largest diameter of the lesion was 53 millimeters. Out of the 30 patients, only 20% of them were going under orthodontic treatment. The clinical diagnosis of the cases from the present sample include idiopathic bone cavity in 28 of the cases, keratocyst in 3 cases, central giant cell lesion in 2 cases, and others such as ameloblastoma, dentigerous cyst, periapical cyst, aneurysmal bone cyst, 1 case per each. Idiopathic bone cavity is still debatable, and the exact origin and nature history of the condition is not fully understood. The most accepted theory is that traumatic injury leads to hemorrhage in the bone marrow with consequences of resorption. Thought only 10% to 25% of the patient report a previous traumatic episode at the affected area. Idiopathic bone cavity affects the mandible in 10% of the cases and represent only 1% of all mandibular bone condition. The posterior mandible is the preferred site, about 70% of the cases, followed by the anterior mandible. There is no sex prediction, and the condition is frequent in young patients in the second and third decades of their lives. Most cases did not associated with any symptoms, no local surface or volume alteration observed in the affected bone region in the majority of the cases, although some authors have suggested that orthodontic treatment could have an influence in the development of this lesion. When multiple areas suggestive of idiopathic bone cavity are present, it's important to consider association with osseous dysplasia, especially in females with lesion located in the posterior mandible and associated with local swelling, because the possibility of etiologic relationship of these entities, some traumatic injury, and its clinical radiographic features is common that idiopathic bone cavity resembles chronic apical periodontitis. It's essential that all teeth in the area should be tested to check the pulp vitality because idiopathic bone cavity has no relationship to the pulp necrosis and periapical condition.